This recording will be going over Chapter 19, Drugs for Eye and Ear Problems, in the Evolve Introduction to Clinical Pharmacology textbook. The external ear extends from the pinna through the ear canal, ending at the tympanic membrane. The ear canal is an S-shaped tube, open to the outside, that ends at the eardrum. In adults, the ear canal tilts downwards. It is slightly curved in an S shape, and it is about 1 to 1.5 inches long. In children, the canal is shorter and straighter. The eustachian tube normally allows secretions to drain from the middle ear into the throat. The semicircular canals are the 3 tubes that contain fluid and hair cells that respond to rotational movements of the head. The vestibule contains organs that sense the position of the head with respect to gravity. Both the semicircular canals and the vestibule will send electrical signals to the 8th cranial nerve. This will help maintain the sense of balance. The cochlea is a fluid-filled organ that also contains hair cells and sensory neurons. It detects vibrations produced by sound and sends electrical impulses to the 8th cranial nerve. Cranial nerve 8 is known as the vestibulocochlear nerve because it receives signals for balance and hearing. The most common ear problems are infection and inflammation that occur in the external ear and in the middle ear. When these problems occur in the middle ear, antimicrobial and anti-inflammatory drugs are given systemically, most often by the oral route. Infections and inflammation of the pinna and the ear canal are most often managed by topical drug application because the external ear can be reached from the outside. Drugs that are prepared for delivery into the external ear canal are known as otic drugs. Another problem in the external ear canal can occur when there is such an excessive buildup of cerumen that sound waves are blocked, hearing is reduced, and the patient will have ear pain. For this problem, instillation of ceruminolytics, drugs that will soften the earwax, can be used, followed by irrigation of the ear. Teach patients to never use a product in an ear that has drainage or discharge, because the eardrum may not be intact and the solution could enter the middle ear, causing an infection. Do not instill ceruminolytic or irrigate the ear canal in a person who is dizzy, because these actions will increase the dizziness. On page 348 within box 19.1, you can read about some techniques for instilling eardrops into a patient's ear. Also on page 348, see the purple top tip for safety. Never place a drug into the ear canal or irrigate the ear canal if drainage is present, because the fluid could enter the middle ear and cause an infection. Although many problems can affect the eye and vision, those that can be managed with drug therapy include inflammation, infection, and glaucoma. Drugs for these problems are ophthalmic drugs, which can come in liquid drops or ointment form. Many antimicrobial and anti-inflammatory drugs have an ophthalmic form, and their actions are the same as their systemic forms. Follow directions carefully whenever giving the ophthalmic form to avoid underdosing or overdosing. This chapter will focus on drug therapy to manage the chronic eye disorder glaucoma, which cannot be cured, but it can be controlled. Drug therapy for any eye problem will require that the drops or ointment be instilled using the correct technique to ensure that the drug is in contact with the eye and that no harm or infection occurs. The eye can be divided into the anterior segment and the posterior segment. The anterior segment divides into the anterior chamber and the posterior chamber. Aqueous humor is produced by the ciliary body, and it flows from the posterior chamber to the anterior chamber, where it then drains through the trabecular meshwork and the canal of Schlemm into the blood for reabsorption by the body. Normal circulation of fluid through the anterior chamber is important in maintaining intraocular pressure at a normal level. Normal IOP should be between 10 to 20 millimeters of mercury. The clarity of the cornea is important because the cornea allows light to enter the eye. The smooth muscles in the iris control the size of the pupil to determine how much light enters the eye at any time. Impulses from the autonomic nervous system cause the muscle to either constrict the pupil, reducing the amount of light that enters the eye, or dilate it, increasing the light let into the eye. Constriction of the pupil is known as miosis, and dilation of the pupil is called mydriasis. There is an easy way to remember this. Meiosis is a small word, meaning a small pupil, and mydriasis is a larger word, meaning larger pupil. Constriction and dilation of the pupil will occur continually as we adjust to varying levels of light in the environment. On page 350 within box 19.2, you can read about some general nursing considerations for ophthalmic drug therapy. The posterior segment of the eye contains the retina and the optic nerve. The optic nerve in the back of the eye will carry signals from the light-sensitive retinal cells to the brain, where they can then be interpreted as visual images. Any increase in pressure in the eye can injure blood vessels in the retina. This can damage the rods and cones and the optic nerve. Glaucoma is a chronic condition in which increased IOP damages the optic nerve. If left untreated, glaucoma can cause a loss of peripheral or side vision and blindness. This disease is often described as a silent thief of sight because the patient will typically have no symptoms other than a gradual loss of peripheral vision. Glaucoma is an eye disorder that results from too much aqueous humor. This fluid provides oxygen and nutrients to the cornea, the trabecular meshwork, and the lens of the eye. The most common type of glaucoma by far is primary open-angle closure glaucoma, in which the aqueous humor does not drain through normal pathways. In rare situations, a condition known as acute angle closure glaucoma can result in a sudden increase in IOP. This will cause severe eye pain, nausea, and vomiting, and the patient could report seeing halos around lights. Acute angle closure glaucoma is a medical emergency. Drug therapy for patients with glaucoma involves reducing the amount of aqueous humor produced by the ciliary body, or improving the drainage and reabsorption of that aqueous humor. Both treatments will decrease fluid pressure in the eye and relieve pressure on the retina and the optic nerve. Drugs for glaucoma are typically given as eye drops instilled into the affected eye. To manage glaucoma, healthcare providers may recommend drugs from 5 classes: prostaglandin agonists, beta-adrenergic antagonists, alpha-adrenergic agonists, cholinergic drugs, and carbonic anhydrase inhibitors. Prostaglandin agonists will bind up the prostaglandin receptor sites in the eye, increasing the outflow of aqueous humor. They help to control glaucoma by relaxing smooth muscles in the blood vessels of the eye, allowing these vessels to dilate and absorb aqueous humor. They will typically be used only once a day and have fewer systemic side effects than other glaucoma drugs. Examples of prostaglandin agonist and beta-adrenergic antagonist drugs can be seen on page 355 within table 19.2. The names, usual adult dosages, and nursing implications of all of these drugs are listed within that table. The most common side effects of prostaglandin agonists are eye itching and eye redness when the drugs are first applied. Over time, patients who take prostaglandin agonists could gradually but permanently develop changes in the color of their iris, from lighter colors to brown. This will occur because prostaglandins increase the production of a brown pigment called melanin. In rare cases, patients who are taking prostaglandin agonists could experience systemic effects, including infection, asthma, and corneal erosion. In addition to the general nursing considerations related to eye drug therapy listed in box 19.2, you should assess the patient's understanding that glaucoma is a chronic disease that requires adherence to drug therapy to prevent decreased vision and blindness. For all patients who are taking prostaglandin agonists, it is important to check the affected eye for scratches or corneal abrasions, as well as other signs of trauma. Never give these drugs if there is any damage to the eye surface. In addition to the general teaching points listed in box 19.3, teach your patient and family the following. Avoid using higher than prescribed doses because higher doses can reduce the effectiveness of the drug in controlling glaucoma. If you have lighter colored eyes, your iris and eyelid color could change over time, and the lashes could become thicker and longer. If you have glaucoma only in one eye, do not place the drops in the unaffected eye, even though the colors of your eyes could become different. Beta-adrenergic agonists, also known as beta blockers, will reduce the amount of aqueous humor produced by the ciliary body in the eye. They do this by binding to beta-adrenergic receptors in the ciliary body of the eye. Common beta blockers for glaucoma, dosages, and nursing implications are listed in Table 19.2. Expected side effects for beta-adrenergic antagonists will often occur within a few minutes of instilling the drops in the eye. These could include temporary blurring of vision, slight burning or stinging, and tearing of the eye. Beta blockers will constrict the pupil. It is important for patients to understand that the pupils will not dilate as easy when they go into a dark room. The greatest risk with the ophthalmic use of beta blockers can occur when the drops are unintentionally absorbed through the conjunctiva, the tear ducts, the nose, or other eye tissues. In fact, systemic absorption can cause the same effects seen with oral beta blockers. Patients can experience decreased heart rate, decreased blood pressure, and even heart failure. Systemic absorption of beta blockers could also lead to bronchoconstriction and asthma symptoms. Determine your patient's baseline vital signs. Watch for any changes in heart rate and blood pressure. If the patient has respiratory problems like asthma or COPD, monitor for any shortness of breath or changes in pulse oximetry. Ophthalmic beta blockers can increase the risk of expected side effects and adverse effects of any oral beta blockers. Never touch the tip of the eyedropper to the patient's eye or with your finger to avoid contaminating the tip. After giving the drops, ask the patient to close their eyes for 2 minutes. This will reduce the amount of drug absorbed systemically. Another option to reduce systemic absorption of the drug is punctual occlusion. This means putting gentle pressure with the index finger over the tear duct in the inner corner of the eye for about 3 minutes after giving the eye drops. Teach the patient to report any significant changes in vital signs, particularly blood pressure lower than 90/60 or a heart rate less than 60 beats per minute. Watch for any changes in respiratory status, including shortness of breath or wheezing, or a decreased oxygen of the blood indicated by a pulse oximetry below 92%. In addition to the general teaching points listed in box 19.3, teach your patient and family the following. Do not increase the dose or use the drug more often than prescribed because excessive use will increase the risk of adverse side effects. Use good lighting when reading. Avoid driving at night because your vision will be reduced. If you have diabetes, check your blood glucose more often because these drugs can mask the symptoms of hypoglycemia if the drug is absorbed systemically. On page 357, see the green lifespan considerations box. Before giving beta-adrenergic blocker eye drops to an older patient, be sure that they are not taking any oral beta blockers for a cardiac condition. If they are, notify the healthcare provider. Older adults are more likely to have cardiac and respiratory problems due to systemic absorption of the eye drops. Alpha-adrenergic agonists will bind to receptor sites in the eye and reduce the amount of aqueous humor produced. They will also improve the flow of aqueous humor out of the anterior chamber, and both of these actions will reduce the IOP. Common alpha-adrenergic agonists for glaucoma, their dosages, and nursing implications are listed in Table 19.3. Side effects commonly experienced by patients who are taking alpha-adrenergic agonists for their glaucoma would include tearing, redness, blurring of vision, and burning or stinging after receiving the eye drops. Some patients may experience the sensation of a foreign body in the eye. Adverse reactions to alpha-adrenergic agonists include bradycardia or tachycardia and a drop in blood pressure. Other adverse effects include allergic reaction, fatigue, and other respiratory symptoms. In addition to the general nursing implications related to eye drug therapy listed in box 19.2, assess your patient's vital signs, especially heart rate, because this drug could cause tachycardia or bradycardia. Let your prescriber know if the patient is taking any anti-anxiety agents, particularly benzodiazepines, antidepressants, or sedatives, because these drugs could increase the CNS effects. Carefully monitor the patient's heart rate and blood pressure for any changes after giving the eye drops. To decrease the risk of adverse effects, be sure to give the exact number of eye drops prescribed by the healthcare provider to the patient. Ask the patient to close their eyes for 2 minutes, or place a gloved finger over the tear duct and apply gentle pressure for about 3 minutes. In addition to the general teaching points listed in box 19.3, teach your patient and family the following. Read packaging carefully because some drugs might need to be stored in the refrigerator or protected from light to maintain their potency. Wear dark glasses when you are in the sunlight or other bright light conditions because your pupil will be dilated and your eye will be sensitive to light. If you've been prescribed this drug for a limited time, like 1 week, don't continue to take it beyond that period. Cholinergic drugs lead to decreased IOP by reducing the amount of aqueous humor produced and improving its flow. When the amount of acetylcholine is increased, the pupil will become smaller. Common cholinergic drugs for glaucoma, their dosages, and nursing implications are listed in Table 19.3. Expected side effects of cholinergic drugs include tearing, stinging, redness of the eye, and blurred vision. Cholinergic drugs will cause miosis, and patients may have difficulty with vision at night or have night blindness. Systemic side effects are possible. They could include a headache, increased saliva, increased urination, and sweating. Side effects can be intensified if patients are prescribed an oral form of a cholinergic drug. Adverse reactions are more common with systemic absorption of the drug. Examples could include changes in blood pressure and abnormal heart rhythms. Other adverse effects include double vision and retinal detachment. Assess blood pressure, heart rate, and respiratory rate because they may be sensitive to changes caused by cholinergic drugs. Assess the patient for side effects expected from any drug that will increase acetylcholine, including increased saliva, increased urination, and sweating. Cholinergic drugs should be avoided by people with breathing problems, like those with asthma or chronic bronchitis. Report any significant changes in the patient's vital signs, including a decreased heart rate or trouble breathing. Symptoms like drooling, severe sweating, or respiratory failure, and severe neuromuscular weakness can all indicate cholinergic toxicity. In addition to the general teaching points listed in box 19.3, teach your patient and family the following. Use caution when moving from light to dark rooms. Remove any excess drug if it spills onto your skin to avoid absorption. Report any increased drooling or sweating or any difficulty breathing to your healthcare provider immediately because these symptoms could indicate a toxic level of the drug. A carbonic anhydrase inhibitor, also known as CAI, will lower IOP by reducing aqueous humor in the anterior chamber of the eye. CAIs are a type of diuretic and are available in oral forms, as eye drops, and intravenously. Common CAIs for glaucoma, their dosages, and nursing implications are listed in Table 19.4. Eye drops can cause slight burning or stinging with administration. In rare cases, redness of the conjunctiva can occur. CAIs can cause CNS effects and must be used with caution. Patients may experience drowsiness, fatigue, and headache with oral and IV forms. Some CAIs are related to sulfonamide drugs, and they can cause an allergic reaction in patients who are allergic to any sulfa drug. When CAIs are taken orally or intravenously, the patient could experience a wide range of adverse effects, including neurologic effects, severe skin infections, severe electrolyte imbalances, and liver failure. In addition to the general nursing considerations and related to eye drug therapy listed in box 19.2, monitor your patient for side effects and adverse reactions, particularly CNS effects, which are more likely to occur with oral or IV drugs. One side effect, a bitter or sour taste in the mouth, could affect the patient's dietary intake, and it should be monitored carefully. Shortness of breath, dizziness, hives, or itching can all be symptoms of an allergic response.